The plastic surgery channel is constantly getting calls, getting questions about the new non-invasive techniques, the non-surgical techniques for fat removal, for skin tightening, for skin smoothing. And we're really able to take advantage of our experts here to talk about those devices.
All non-invasive techniques share one common thread, and that's delivering energy to the tissue. Unlike invasive surgery where you put a scalpel to skin, here you're delivering energy. It could be light-based energy, ultrasound energy, or more recently radiofrequency-based energy. I'm very excited actually about the Thermi system, which applies radiofrequency energy, but we call it injectable RF. So we make pinholes in the skin and using a probe inject the radiofrequency and monitor the temperature externally, or you can just use a completely non-invasive system where the energy is applied topically.
So with these devices, the Thermi, you can get some skin tightening, you can get some fat removal. Ned, what about cool sculpting? Are these too good to be true?
No, we're actually really excited about cold technologies. We're taking fat cells down to a temperature that they freeze or that they die without injuring any other tissues. It's a permanent reduction of fat for the areas that are most common for people to complain about, be it love handles, be it saddlebags. And it really works, but it has to be in the right patient. It has to be used in the right way. If you go to a board-certified plastic surgeon, this is someone who has all the tools in their toolbox, meaning that they have the ability to do liposuction, something invasive, versus cool sculpting that's non-invasive, but to choose the right procedure for the right patient.
We can actually get close to surgical results.
That's right.
Sometimes you can. In fact, sometimes with the Thermi on the neck, I see results that I think even exceed our ability surgically, because the neck is an area of continual frustration. I know it is for me sometimes with facelift patients, and you're changing the quality of the tissue, which surgery does not do. You can achieve more sculpting and more fat reduction with liposuction, but the ideal patient for the cool sculpting is someone who comes in and says, look, I'm willing to accept a little less result, but I don't want any downtime. So there is zero downtime in most cases, and some of the results have been astounding.
So the real take-home here is, number one, look at the non-invasive devices. They are efficacious, but be sure that you talk to a board-certified plastic surgeon who has the whole menu of options.
Couldn't agree more.